Well, hello and good morning.
Good morning.
Always nice to see you, Dr. Rosensweet.
You too, Carolyn.
Thank you. Hoping you're well, and I'm going to welcome everybody who's going to be coming up. Hello, hello. Happy week. And guess what? Questions, questions, questions. And you have a hard stop, so we're going to get to them right now. Number one, you ready?
I'm ready.
All right. Um, Question number one comes in. Dr. Rosensweet, are compounded bioidentical hormones approved?
Well, ultimately that designation approved refers to the Federal Drug Administration, the FDA, approving. And they have not granted their approval, but they're totally legal. 100%. And they've been around since the 1980s in the United States, being compounded by compounding pharmacists. Compounding pharmacists have been around since the dawn of time, whenever people started putting together mashes and herbs and potions and stuff. They eventually developed licenses and procedures.
Well, it
and they
wasn't alchemy.
and they became pharmacists. And all pharmacists, up until very recently, were compounding pharmacists, every single one of them. They were getting the raw ingredients and we're putting them together in different potions, bottles, pills, capsules, etc. When I was in medical school, many pharmacists were still doing this. They were taking some raw materials. And then the pharmaceutical industry started getting extremely official about things, very precise, putting things up in pills and different, liquids and stuff. And more with the rise of corporations,
Yeah.
and we won't go into that little issue there.
It's very
Things got
small.
more routine, and most pharmacists became pill counters. They transferred pills from one big bottle into small bottles based on the prescription. Bless their hearts, I've had very, very many beneficial experiences with pharmacists of every rank, although it seems very hard and tedious on them these days compared to when I started out. And however, there's a group of pharmacists that never stopped compounding. In fact, there's 8,500 of them in the United States alone. They're all over the world. They are all approved and regulated like crazy by each individual state.
Yes.
States
Yeah.
have states have pharmacy boards just like they have medical boards. The only way I can practice medicine in any state in the United States is to have acquired a license in that state that comes from the medical boards. And pharmacists are just the same. They have a board of pharmacy and they have to apply for a license and be granted a license. So every one of these 8,500 compounding pharmacists in the United States, there's probably many in most viewers here town. They have acquired that license, and because the pharmaceutical industry, oh boy, going into some hot water here. I'm going to preface this by saying I'm a big tent guy. I want good medicine. And there's many benefits to the pharmaceutical industry. Oh my God, they've changed the nature of human life by widespread production and distribution of much needed medications. But that's not the only thing going on.
Right.
For some unknown reason, some of them want all the money. And so they want to get rid of these compounding pharmacists. So that's a whole road to go down, and I'm not going to go there. But just for example, I mentioned many times on our chat that in 2002, the most popular and profitable drug medication in the United States was Premarin and Prempro. Profitable and popular. 18 million American women in menopause, 40% of those in menopause in the United States were on Premarin or Prempro. Then out comes this falsely reported study that the cat got out of the bag and everyone got frightened of prescribing it, thinking there was an increased risk. And I've gone over this many times. The actual study itself did not indicate that there was any increased risk that was statistically significant. And they went on to retract that study in 2017, saying women who are on hormones are at less risk for breast cancer, heart attack, and stroke than women who are not on hormones.
You froze. There you are.
And but at any rate, when that study came out and just was exploded all over the planet, it scared women tremendously and providers. And the market went down from about 18 million to way down to the low 1 or 2 millions. And then that means all those women were adversely affected.
They suffered.
And getting all the ravages, I'm going to use that word, of menopause. Some people would like to debate me on it any day, any time, any place. I'd love to do it. And they retracted that, but in the meantime, from 2002 to 2016, when that study was published, there were now 6 million women, American women, on hormone treatment in menopause. 18 million to 1/3, 6 million in the United States, and over half of them were on compounded bioidentical hormones.
May I ask, aren't compounding pharmacies protected by laws of Congress to compound?
No, they're not protected. They're governed by the states. And I don't see protections. I see adversity. I see pressures and major pressures. And so out there in public, we get a question on our Facebook Live concerned about the validity of compounded bioidentical hormones. Because the rumor out there, and traditional doctors have been, this is what they've been indoctrinated with, is that compounding pharmacists are not okay. And there's a lot of pressures, there's a lot of activity to eliminate compounding pharmacies. And that's one of the ways that this has been done, is through the back door. These folks are very savvy, who want the money. They're very savvy, and they got a lot of money to play with. And what they've done is they've increased state regulations just astronomically. And they've come out with a few egregious federal regulations, way over-regulating this industry. And causing, because of the way they over-regulate them, is they make them adhere to these practices that are far excessive in what's actually needed. So it costs these pharmacies, like there's a pharmacy in Colorado, in order to conform to the new FDA regulations. These were national. These aren't protections, I declare. This pharmacy had to spend $1 million to upgrade the facilities to make these negative pressure rooms, and have the compounders work in hazmat suits. This is not needed for compounding bioidentical hormones or anything else that is commonly compounded.
Right, yeah.
And so this has knocked out of business a lot of mom and pops, local compounding pharmacists who just couldn't afford to conform with these excessive regulations. So there's been a lot of pressure. And I don't know that there's a more heavily regulated industry than these compounding pharmacists. Now, on the flip side, I met up with compounding pharmacists in the early 1990s when I really started establishing relationships, because they were the ones who were individualizing, custom making prescriptions for hormones for women, and they were willing to do the individualization. So I could write a prescription for what was specific to my individual patient. You can't do that with what the pharmaceutical industry offers. What the pharmaceutical industry offers are these 1 or 2 or 3 dose things, sometimes a little more, that do, the moral of the story in menopause and andropause is get on hormones. And even Premarin or Prempro, this horse urine-derived estrogen, did a lot of good on this planet to those 18 million women. They were in health, they were in better health than their compatriots for the most part, just because they were on hormones. So I'm a big tent guy. I want women and physicians and nurse practitioners to prescribe great medicine and their choice. That's all I care about. That's what I care about. It's not all I care about. It's what I care about. Great medicine. Well, it's better than no medicine to prescribe these 1 or 2 dosages. Absolutely. These people do much better. So I'm a big tent. But the best medicine in treating women in menopause and men in andropause, we are absolutely in necessity need the compounding pharmacists. Because the difference in individuals, like you're going to walk out somewhere today and maybe you walk down the street and you're going to see a lot of women. And you're a woman. And you could say, well, gosh, we're sort of alike. And I could say that's very true. However, as far as your hormonal needs and balance goes, there's major differences, as I've pointed out many times. Some women need this much estrogen to be fertile, young, regularly menstruating, where other women need this much, 3 times as much. And there's 4 hormones we're talking about here, so the individual balance of each hormone varies woman to woman. It makes the variation just astronomically. I can't even illustrate it on my screen. It's no problem whatsoever. We have elegant, easy to understand, easy to teach methods for individualizing every single woman, because that's the health we want to individualize for them. Well, the compounding pharmacists, they can do individual prescriptions, and they do. And it's infinite variability there. Like for estrogen, I can prescribe a bias that's 30 milligrams per milliliter, 80-20. But some women are going to need a bias that's 70 milligrams per milliliter, 50-50. Varying in both the amount of 2 estrogens that are in the bias, plus the ratio of those 2 estrogens. It amounts to an infinite number of possible prescriptions. No pharmaceutical manufacturer can keep up with that. It would not be, they couldn't make a living. They couldn't stay in business if they had to do that. But the compounders have been doing this forever. They get a prescription from me or thousands and thousands of other providers in the United States and all over the world, really. And they just fill it. And they love it. And this is the other thing about the compounders. I was surprised when I first met my first compounder. He was just so interested. Tom White, shout out to you if you ever see this. Bless your heart. I met up with the world of compounding pharmacists. These were the pharmacists that loved putting together these things. And they had these sophisticated instruments to do so, these analytical scales, and they made up individual prescriptions. And their level of interest and vitality and love of their profession was off the charts, because they weren't burdened with filling one prescription after another, just counting out ampicillin pills and then Xanax pills and putting them in a bottle. Bless the hearts of those pharmacists who do that. Mostly techs these days. But and then because over the years, I met many other pharmacists. Our organization has 31 pharmacists that dispense our organic oils all over the United States. And also because of reasons, I'm a co-chair of a coalition to protect bioidentical hormones, and my co-chair is the CEO of the compounded pharmacy organization. Shout out to Scott Bruner and all the wonderful compounding pharmacists that are in this organization. Jim Herntzer, hello there, many others. So I get to know, I've talked to hundreds of compounding pharmacists, and these are the most interested, intellectual, precious, analytical. It takes a certain degree of precision to do this work, and you've met personalities that are super strong in precision, and you've met up with personalities that they're more artistic. They're not, their beauty is they get really creative, and they're loosey goosey about being absolutely precise, right? Well, at the end of the spectrum, at the really intensely scrutinizing, careful, precise end of the spectrum exists these compounding pharmacists. So you start talking to them, and they're not going to be a microgram off in their, let alone a milligram. 99% of them are going to be that precise. So they're quite a group of people, and they're humans, so they're fun too.
Oh, yes. You
Because I
did
know
an
so many of
interview.
them. I know so many of them, and they're all under the pressure of
Yeah.
trying to get forced out of business, really, for false reasons. So back to the question, I believe there was one back there.
Well, I think that,
Are they FDA approved? No. Are they regulated are they licensed? Yes, in every single state. Are they FDA controlled? Yes, by intense regulations. Are they there? And again, they get inspected. How many times does your local grocery store get inspected? Or your local meat processor get inspected? Well, I don't know those. But these compounding pharmacists, I constantly, I'm communicating with one of them. They said, well, we're going to have a little delay. We're getting inspection in the last 3 days. These folks are heavily regulated. Who do I love and choose? Compounding pharmacists. And I wanted to give such an extensive answer because we love these folks, and they're challenged. And it's really unfair for a professional that devotes their career and their life to doing great work for people, because they're very connected to patients too. You talk to all of them, they want to serve the patient.
yes. And many women that I speak with are taking compounded bioidentical hormones, and they are having them compounded out for them. I would believe well. I know mine are compounded out well. So can this woman feel safe to take compounded bioidentical hormones?
Well, there's
I
there's a
know.
word there that I need to deal with. But yeah, not 2016, 3.5 million American women like yourself. Who knows what it is 7 years later when this has become more and more and more and more popular. The word is safe. Yes. Women who are treated with hormones are at less risk for breast cancer, heart attack, and stroke than women who are untreated. Number one. Now, we're all at risk for a lot of diagnoses. I'll tell you, as a medical doctor, I've seen a lot of them. And we're all at risk for cancers, hundreds of them. And we're all, as a male, I'm at special risk for prostate cancer, and there's reasons for that. And women are at special increased relative risk for breast cancer, and there's reasons for that. But given that, women who are treated with hormones in menopause are at less risk for breast cancer, heart attack, and stroke than women who go untreated. Men who are treated with testosterone are at less risk for breast cancer, heart attack, and stroke than men who are not treated. Breast cancer, no, prostate cancer, excuse me. So
I didn't want
that's the
anything.
biggest element of safety.
Yes.
And then it's hard to make errors that are really egregious in treating, because hormones are the most powerful biochemicals in our body. And if we take too much of them, we feel lousy. We get symptoms of overdose. Most women who take too much estrogen, they get breast tenderness, breast pain. They'll bleed. They'll get their periods. There's all kinds of things that can happen. So it's pretty unusual for someone to be put on excessive dosages. That's an error you could be make. And that's why there's lack of expertise and specialization in the world of hormones, because what traditional doctors were trained is, here, give the woman 1 or 2 pills, and we don't have any way to test you, and the scrutiny wasn't there. And so safe in and then the other end is the compounding pharmacist. Do they make mistakes? 30 years of me dealing with over 31 compounding pharmacists. I've seen 1 or 2 minor errors. Very minor. We know how to test for them, and we know how to uncover them. And sure enough, one potency was off a little bit. So we weren't getting the same results as the woman got out of previous bottles. So we were a little suspicious, and we're very scrupulous ourselves. So we went and retested the formulation, and they were off a little bit. But again, it's not too easy to be that far off, because you're going to get symptoms. If you're off in a too little direction, where you don't have enough strength in the prescription, the woman's going to continue to have symptoms. If you're off by too much, most, not all, women are going to experience symptoms of overdose, and they're not pleasant.
Not at all.
Baffling. You can even start getting hot flashes from overdose for reasons. There's technical reasons. I won't go into that right now. But you can certainly get breast pain, nipple pain. You'll feel lousy anyway. And you got to be somewhere in the ballpark of good dosaging if you get symptom relief. You're not going to be spot on. We did a study that showed that. We showed that when women say, wow, I feel better, I feel like myself again. Well, 25% of the women who say that, and we go to test them, they're within really optimal dosage range. But 50% are on too little still. That's not enough to protect their vagina and their bones. That's significant.
Oh, yeah.
Let alone their arteries and their brain. And 25% of them are in dosages which puts them at risk for breast glandular cell proliferation. We don't need that. You don't need increased breast density. So safe. Now we get down to how precise, how well trained, how expert, how careful is the prescriber, because you asked the question around safety. And again, it's hard to make errors. At one point, I had a woman who was 60 come to me. She had surgical menopause, removed her ovaries too, at the age of 40, and she was put on Premarin. And I'm going to tell you, this woman looked good and felt good. She came to me because she was sort of interested and curious about these bioidentical hormones. And in taking the medical history, I heard that she had never had breast tenderness in her life until she was put on Premarin, and then she had breast tenderness for over 20 years. And that means that she get an increased breast density, but that was a dosage problem. She was just a little overdosed. Case of one in medicine and in science, that's called, oh my God, it's nowhere near any validity. But you can still get overdosed and not get into trouble, because the causes of these severe illnesses like cancer, which can be severe, they run silent and they run deep. And they add up to all the indiscretions of nutrition, toxicity, exercise, and dysfunctional response to stress, and some mysterious
stress.
that cause all illnesses. So there's a simple answer that only took 25 minutes.
And that's okay. I take compounded bioidentical hormones. I feel better for just me. We test okay, and we keep it moving. And having doctors like you that, help us along is very comforting, let me just say. So thank you very much for that answer, Dr. R. I'm going to move on to question number two, uh, which states, I'm wondering, Dr. Rosensweet, about the difference between progesterone, prometrium, um, wondering if Dr. R has a problem with women taking prometrium or even pregnenolone.
Good question. As 100% of the questions have been,
Mhm.
since you and I started doing this stuff.
Yes.
Prometrium is a pharmaceutically manufactured micronized progesterone in a capsule that you take by mouth. And why did it come into existence? Because when the pharmaceutical industry woke up to that they were losing a lot of market share to compounding bioidentical hormones, one by one they tried to come up with a version of them. And progesterone in capsules was the first one they came up with, prometrium. It's been around for quite a while. Wasn't there when I started out, but I think primarily because of the market share situation with the compounders. That was the first product they came out with. And they were using prior to that, and they still do use, things called progestins. These are molecular alterations of the progesterone molecule that are not bioidentical, not
Right.
identical with the human ovary produces. They got
Right.
issues. These progestins are, well, we have on our medical board Phyllis Brunson, who's an absolute world expert on the progestin molecule. And she said a lot of detrimental things about it. So at any rate, they're still being sold in rather significant amounts. But the pharmaceutical industry also started manufacturing prometrium, which has micronized bioidentical progesterone in this capsule. There's some downsides to it. For one thing, it's got other things in those capsules.
Mm.
It's got some dyes and it's got some metals in there. And they're put up in peanut oil. I don't know how they get away with that, with the amount of peanut allergy that's out there. But there's a lot of women who've been put on prometrium that we don't hear about these widespread reactions to the peanut oil. And it comes out in two dosages only, 100 milligrams and 200 milligrams. If the only progesterone I had access to was prometrium, I would use it 100% of the time. Now, I've got access to a heck of a lot more. For one thing, we've got access to topical progesterone that we can put up in our organic oils. So that's my favorite. You apply it to your skin. And sometimes we switch to oral progesterone, but we always individualize the dose. So what I do when I think that it's time, it's appropriate to switch to an oral micronized progesterone without all the stuff in it, without all the metals I forget what metals are in it. You can look it up online and read what, excuse me, read what's in that capsule. You'll see a lot of things in there.
Well, yeah, like
I can
alcohol.
get very pure
Yeah.
compounded progesterone, and I always prescribe 30 capsules of 25 milligram and 30 capsules of 75. And we start most women out on 50 milligrams, 2 of the 30 milligram capsules. Some of them we start out on 25 milligram capsules when we think there's a special sensitivity. And every 3 days, we increase it by 25 milligrams, from 50 milligrams to 75 milligrams to 100 milligrams
Yeah.
to 125 milligrams. We have the woman explore and discover what's her optimal dose. Pretty easy to do. And we have women take it at sleep time because of the special sleep benefits. Although some women can take it during the day, absolutely. And if a woman takes the right amount of progesterone, she sleeps better. If she takes too much progesterone, it's too calming, so to speak. So she's going to wake up feeling groggy, like she'd been overdosed on a sleeping pill. So let's say she did really well on 125 milligrams and went up to 150 milligrams and woke up the next morning feeling groggy. Overdose. We back her down to 125. Then I write on my next prescription to the compounding pharmacist progesterone oral 125 milligrams. So what is the range of women in my practice who are on oral progesterone? Anywhere from 25 milligrams to 300 milligrams. Most commonly somewhere between 75 and 150, but they're all individual. So 100 milligrams and 200 milligrams is never going to serve my practice. We like to dial it in with a level of specificity. If again, there's an advantage to Prometrium. Most compounding pharmacists cannot accept insurance because the insurance companies are not willing to do it. Some can, but they gotta work at it to get their reimbursement. But they can. But a lot of compounding pharmacists just can't hire the extra employee to be dealing with insurance that it takes, so they're cash only. And Prometrium is covered by most people's insurance. That would be the principal advantage to taking Prometrium. Can you combine the two? Yeah, sometimes we do that. It's not common. Usually, when we see that a woman's going to switch to oral progesterone from transdermal, we usually say, let's just switch and you'll be dealing with one progesterone. But some women, that oral progesterone at night really helps them with sleep, and the topical progesterone really helps them in the day. Some women benefit just by the calming effect, thus helping them with daytime anxiety. Progesterone's the great calmer, unlike almost every other hormone, which is the great energizer. Progesterone's calming. So it's fine to take both. Again, it's very unlikely you're going to overdose on progesterone. You're going to feel groggy, wobbly, drunkish type thing. You're not going to overdose on it willingly. Right. So it's fine to take both. And yeah, if cost is an issue, we're working to eliminate cost issues. And soon, it's a process. We're going to be able to offer women all 4 ovarian hormones, which would include progesterone in capsules or progesterone topically or both. For those who get in on the ground floor, providing, what do they call it? Inflation doesn't change us here. For $99 a month, all the 4 hormones you need every month.
That's
for $99
amazing.
a month, whatever the combination is, oral. We're not going to give you oral estrogen. We're not going to give you oral testosterone, but we would definitely utilize oral progesterone. And so $99 a month, folks, in organic oils, the topicals. Think about that one for a bit.
Yep, and boy, am I getting
we're trying
a lot
to break
of
this
questions
barrier.
about that.
But if insurance is your only option, you can put together insured payments for estrogens that are manufactured and insured and Prometrium. You can't get testosterone paid for by insurance unless it's injectable. But at any rate,
right,
that's the finances of it. So all of it's good enough. And is there great? Yeah. Read the book, Happy Healthy Hormones, that Carolyn posts on the ins and outs of menopause. Here I describe what I consider to be the top of the line approach to menopause, and you can access it.
Yep. And I
find a provider to take care of you.
Yes, well, thank you. And
gosh, Carolyn, I can't hear you.
You can't?
Let's see what's happened here. Can anyone else hear Carolyn? Carolyn, would you speak? I don't know what happened here.
I mean, I could. Can you hear me?
My goodness.
You hear me?
I
Uh-oh.
love technology, but occasionally
Yeah.
it's a little disappointing. So you can hear Facebook user, you can hear Carolyn. Can you
Okay,
hear me?
so, oi, but you can't?
Okay, well, great.
Hang
Now, how do we get the next question?
on.
Because I cannot
Um,
hear Carolyn. Let me see if I can do something about it. Yay.
okay, cool.
I'm going to try something.
All right.
Carolyn, would you say something?
Yes, I can say something. You're not hearing me?
Well, maybe you could put the question in the chat because it
I
sounds
am.
like the viewers can hear both of us. Isn't that
All right.
remarkable? Or not remarkable?
Hang on.
Okay, questions in the chat, and thank you, Facebook user, for. Okay, is it okay low estrogen and feel safe? The answer is not, not really. Safe. That's women have lived into their 80s and 90s, and I'm breaking up. Yeah. Okay. Bear with me, folks. We're gonna when TV first came out, and I was around when it first. So often, the screen would go wonko. Thing called a test pattern, and that's all we'd see on the screen while they did whatever technical to do. So we're gonna have a break here.
Yeah, you're kind
Trying to
of going in
see if I
and
can
out.
do something about the sound. So I continue to go in and out, to reboot. But if you can't hear me, that really matters.
Yeah, it does. Um, I mean, yeah, they're hearing every other word.
Yes, I hear. Am I still going in and out?
At the moment, no. I don't know if you keep talking. I don't know where you went. Uh-oh. All right, you
No,
guys,
I
you're
thought it was
stuck.
going back in. Can you hear me?
We're reading lips.
Hey, tuned in, folks. We're gonna see if I can pull this.
So, ladies, Dr. Art should be back. Bless him. These technological problems are so crazy. Are you there?
Yeah, how about now? Can you hear me?
Yes.
Well, how about that?
Yes.
It's good.
Want to
So,
do the alphabet?
so I'm going to go back to that question. Would you read me that question again?
um, Dr. R, don't you feel that it's really important for all women to know that everyone would feel a lot better knowing that it is okay, that low estrogen is okay and can be safe?
Well, let's look at history. Throughout history, for the most part of human life on Earth, 100,000 or 200,000 years, there was no menopause.
Right.
There was no low estrogen states except childhood. Women didn't live into menopause. Few probably did, but not many. And then, with the extension of life through hygiene, etc., there came a women were living longer, so there was a menopause, and women were living with low estrogen. And you know what? Occasionally, some of them did really well. But let's talk about 2023. There's been an explosion in the number of nursing homes and assisted living facilities. High percentage of who's in them is women. Why are they there? Consequences of low ovarian hormones.
Right.
I'd say I'd made a wild guess about this. I don't know the exact number. I did discuss it with someone on our medical board, Dr. Brixton, and we were making a wild guess that 80 to 90% of the women were in assisted living facilities and nursing homes because of low hormones. And what does low estrogen lead to? Cognitive issues. Not in every single woman. There's some women who are 100 years old that are sharp. But you don't, how many do you know? How many have you met up with?
One.
Yeah.
Literally.
A lot of women have cognitive decline, and not all cognitive decline is from low estrogen, but the majority of it is in women. There's so many estrogen receptor sites in the brain.
Yes.
So, and a lot of them in there because they're in adult diapers and they can't be managed.
Right.
And one of the reasons they're in adult diapers is because they've gotten vaginal atrophy and irritation to the urethra and bladder, and they get incontinent. Or half the women who are on Earth and leave Earth do so because of the consequences of coronary arteriosclerosis, heart attack, and stroke. Young women have a much lower risk of stroke and heart attack because they get special arterial protection conveyed by the presence of estrogen. And they lose that estrogen, that protection's gone. And again, half the women who leave Earth do so because of consequence of arteriosclerosis.
Right.
Many have estrogen too, nowhere near as much. And the men who have low estrogen, well, every so often you hear something about men that you don't hear about women. Couldn't believe it. 40 years old, had a heart attack and died on a tennis court. Never sick a day in his life. A lot of men who are having those calamities have it because they're low estrogen men, too low. Men need a certain amount of estrogen to protect our arteries. So low estrogen, is it okay? I don't like the odds. Never mind intercourse, never mind vaginal health enough to have intercourse, never mind to have energy and good immune function. Estrogen plays into the immune system, on and on and on and on and on. So do some women live with low estrogen? Yeah, a lot do.
Well,
Especially after the women's health.
there are
Especially after the
many.
Women's Health Initiative scared everyone away from estrogen. A lot of women still lived, but they weren't doing well. And women also need testosterone. Young women have more testosterone. They have the most potent estrogen, estradiol. And you need it for muscle health. And as you lose muscle health, when your ovaries stop producing that testosterone, your thighs and legs get thinner and thinner and thinner,
Right.
to the point where you're using canes, walkers, wheelchairs. It's that walker to wheelchair change that makes it almost, it's really challenging for most families to be able to take care of the parent at home. So they wind up in assisted living. God bless assisted living facilities and nursing homes. Oh my God, it's a miracle that they exist. And our family felt it as much as anybody did. With my mom in an assisted living facility and then a nursing home. But I want to tell you, you're going to want your estrogen because the risk of not having estrogen and the risk for arteriosclerosis and vaginal atrophy is not a risk. You're going to get vaginal atrophy.
Most unpleasant.
The risk for cognitive decline and arteriosclerosis alone is so huge that I recommend that you do not take that risk. And I recommend hormones for everybody. Men too. We're just talking about women right now. Low estrogen.
Right. And it goes back to what you were saying before. I mean, I've heard many, many times women saying, my doctor has me on the lowest amount of hormones possible for the lowest amount of time possible.
That was an invention. That was not copying nature. Women's Health Initiative scared everybody. So millions, maybe 17, maybe 16 million women stopped taking their hormones. And providers, physicians, and nurse practitioners got frightened to treat women with hormones. But the women who went off the hormones had tremendous duress. Hot flashes, can't sleep. All you got to do is not sleep. Let's go for 3 nights of not sleeping. Tell me how you're going to do with that. Because a lot of women can't sleep because of low estrogen. So millions of women went into duress and went back to their doctors and said, look, I can't do this without the hormones of some kind. So they invented this lowest dose for the shortest period of time. Totally thought, you could see why they would, frightened as they were, they would come up with that strategy. And lowest dose for the shortest period did something rather than nothing.
Right.
But it turned out that the original study was shown to be wrong in that women who were treated with hormones were at less risk for breast cancer, heart attack, and stroke than the women who received no treatment.
Right.
So that strategy was an interim strategy. And now there's all kinds of papers coming out saying, no, take them as long as you're alive.
Yes.
And I still don't see a lot of promoting take the right doses and not the lowest dose. You don't want to take the lowest dose. Let's say you get an infection. Do you want to take the lowest dose possible of an antibiotic?
No.
No way. Let's say you have hypertension. You want to take the lowest dose of the antihypertensive and just tolerate the consequences of not regulating your blood pressure, or the lowest dose of an antiarrhythmic drug that when you've got a cardiac dysrhythmia and your pulse isn't regular, you want to take the lowest dose? Well, yeah, but you got to have the result. You want to take the lowest dose with the result. Now, in the world of hormones, I don't ever recommend the lowest dose, ever. I want to just add that one. You want to take the optimal dose.
Right.
Like for progesterone and estrogen, so many women have lost bone and they're dealing with osteoporosis or osteopenia. We want to optimize. We want to go robust with progesterone. We like to jack that progesterone up until the woman experiences symptoms of overdose, then back her down a little bit so she's not on overdose. Same with estrogen. We want to optimize that dose, and it is not, N-O-T, the lowest dose. It's the right dose.
Right. And then for the shortest amount of time.
So the answer to your question, am I going to recommend to any human being, woman on the planet to not take estrogen? No, none. I'm going to recommend that to zero.
As in zero.
Women, I'm going to recommend you get some estrogen and you get some progesterone and some testosterone, and you're going to do well. Now, I also never like to violate a woman's intuition.
Thank you.
Or exceed their boundaries. So we do in the menopause method, we proactively address in the first consultation, some doctors do it before the first consultation, the subject of risks and benefits. We bring it up because my experience is that 100% of the women that I've ever sat in front of to consult with, whether they're going to say it or not, have concern because of what happened, the false information that was spread like wildfire on this planet. They're going to have a fear if they take hormones, they're going to be at risk.
Yes.
So we proactively address the subject of risk. And if I sense that the woman still is not comfortable, even after what I've told her, and what I tell her is the science is that we're all at risk, like I mentioned earlier. However, we're at less risk for breast cancer, heart attack, and stroke, women are, if they're treated with hormones than if they're not.
Yes.
We're all at risk, but women are at less risk if they're treated with hormones. If a woman still feels uneasy, I say this to them, and this is part of the menopause method. There's no urgency here. We're not talking about disease. let's respect what your concern is. Let's pause. You don't need this. If you had hypertension, I wouldn't say let's pause. I'd say my recommendation to you is start that medication today.
Right.
But
Like
this is
now.
not an illness.
Yes.
So I say let's pause. Let's respect the concern you have. And what I know for certain is that if you spend time over time, like for example, if you do due diligence and you learn some things, here's the books to start with: Happy Healthy Hormones and Estrogen Matters by Avram Blooming and Carol Tavris. You could post that one again. That's very thorough about risk. Read chapter 3 about risk. Somewhere along the line, if you care about the topic and you're willing to do some discovery of whether this is appropriate for you, you're going to know with absolute conviction, yes or no. And if you
Yeah.
still come up with no, bless your heart. But no, we don't need to start these tomorrow. Here's what happens. Some women that I've had that actual consultation with and did not start hormones, 6 months later, a year later, I'm hearing from them. The consequences of the no hormones have been so dramatic that they realize, and they've done some reading, that, oh my God, I get it. These are for me. And that initial concern is evaporated. Some women I never hear from again. So I don't know what's happened. And bless their hearts, no hormones, fine. And other women, so time will help women, and a little due diligence will help women know for certain what's right for them. And then what's right for anybody isn't written in stone. You start the hormones and you feel like they're not right, you stop them. How many times does that happen in my career? Pretty close to zero. Once a woman starts feeling the benefits of those hormones, she goes, I'm healthier. I sleep. I feel better. So it's not rocket surgery, this whole subject. It can seem like it. It can seem very daunting to someone who's going into menopause and is concerned.
Oh, yeah.
But ultimately, it's not. You can figure it out for yourself. If you have a provider that's willing to communicate with you and be patient, that's why you're a patient, and the provider has to be patient too. That's why we're a patient too. I have a degree in so that I can be called doctor, but I really have to be patient.
Patient.
So you'll figure it out. You'll get the right thing for yourself. So
Got
Carolyn,
it. I
uh,
know.
I need to
I
complete for today.
know. So
And when are
we
we
will,
back? We're back. We're going to go to every other week, just
right,
because of my obligations out there on the planet.
but we still
And
have January, so we will do next Tuesday. Yeah, the 31st, I think.
yeah.
Yeah.
Mhm.
So we can continue on with this. I mean, we actually made it through most of the questions, which is amazing, and it's great. And thank you, everybody, for giving us the direction we needed so that you could hear us. Appreciate that. Dr. Rosensweet, dear Dr. R, have a wonderful day today. Everybody have a wonderful day today. He's got the hard stop. I guess I'm going to have a hard stop too then. And just enjoy. And we're going to go ahead and pick this up next Tuesday, get to these other little pieces of the questions, and I'm going to say adios.
Bye-bye, everybody. See you next week.